as of yesterday, they have reduced the total lockdown. We call it the movement control order. They have reduced it to only a few states. There are 4 states which are under the total lockdown because the numbers are quite high. We are recording about 2,700 odd cases yesterday. The deaths seem to be quite high. We had 14 deaths yesterday. As for the vaccine, the rollout is expected on the 26th of February. In fact, today, the vaccines are arriving in Malaysia from US. 26th, they're going to start with the frontliners first. Now, we are still awaiting the list from the Ministry of Health as to who are the people who are going to be the first few 100,000 to be vaccinated, because they are receiving 1 million doses today. And they are planning to vaccinate 500,000 people because it's 2 doses. And we are going to use the Pfizer vaccine. And that is the status of our vaccination program so far.
What is the total population of Malaysia, and what is
Malaysia's population is about 32.7 million.
32.7 billion.
Yes, they expect to vaccinate about 80% of the population by April 2022. And the latest, they also are going to vaccinate all the foreigners, the migrant workers, all those foreign people who are here, as well as they are willing to vaccinate the illegal or non-documented workers in this country. Now, that is a bit dicey because the first time around when they asked them to come for COVID testing, many of them were arrested by the immigration because they were non-documented. So we do not know how that is going to, how they're going to respond, because there are approximately 2.something million or 2.2 million non-documented foreign migrants in this country.
So this is the picture of Malaysia you can see here. This is the picture of Malaysia, which is now showing a decline. Am I correct?
Yes.
This is what Malaysia looks like.
Yes.
It is showing that it was constant and suddenly it shows a spurt of around, the maximum cases has gone is around 4,000 per day.
Yes.
And it is now declining.
Yes.
And the
because of the total lockdown.
So you feel that total lockdown has created a difference?
Yes, definitely.
Okay. So we come back to Deborah. What is the situation?
Good morning.
Good morning.
Here we had problems to start the vaccination, but now the vaccination started. I had the 2 doses of coronavac vaccine, and here we have the Oxford vaccine too, but it's very slowly, and especially in my state, we had a big problem because all the hostels are full of patients. There are no beds for new cases. I'm very worried with this.
So what is the current infection rate? And the cases are going down, or?
They are increasing here.
They are increasing here. Okay.
Yes, they are increasing, and people don't use masks correctly. We have big problems with this.
Okay, so Brazil, we have a problem going on. Angelic? Angelic, anything new?
Morning.
Yes.
Morning. We just started with the vaccine rollout. There's not a lot that I can say about it. It is it's a very interesting rollout because it seems to me that not all the provinces are really prepared as as they should be. So we will see what happens, but it's only 2 days ago that it started. So our case load is coming down. It's between about, the average is about 2,000, 2,300 per day.
So the things are getting under control. You can see
Yeah.
here, it is on decline. And what do you think the reason can be for decline in spite of new variant?
You know, I think it's because of the lockdown measurements that's been put in place regarding, you know, the closing of a lot of taverns. And although we have opened it now, it's been opened, the lockdown restrictions, some of them have been lifted the last 2 weeks. So we'll have to see, you always look back 2 weeks in the past if you want to look at your results or your numbers. So I think we would see within and our schools only opened this week again. So within the next 2 to 3 weeks, we will see whether there's again a rise or not.
Okay, we will come back then. Hong Kong, this is the picture in Hong Kong. Alvin?
Good morning, KK. So in Hong Kong, our situation had improved a little bit, but not yet down to zero. So the lockdown effect is, well, okay, but not perfect because we couldn't really have serious lockdown in a way because the people honor their own freedom and like to have the choice. And so all along, we are still limiting to social gathering to in public to less than 4. And then for lunch time in public, people could eat together in 2. But then evening, we still had no public dinners until yesterday. The government relaxed the lockdown rule and allow people to have dinner outside in the restaurants. And so yes, from yesterday, many of those businesses have resumed, and the gyms, all those beauty parlors and cinemas have also reopened, and the sports centers being reopened. And we are going to launch the vaccination campaign. And so the first vaccine to arrive in Hong Kong now dramatically will be a Sinovac from mainland China, although they didn't really have published the 3rd phase trial report in academic journals, peer-reviewed journals. But the scientific committee in Hong Kong made a special, well, I would say that they gave them a special review. And then judging from their own data, not published yet, and they think that it's safe for Hong Kong people to get vaccinated, and that is the benefits outweigh the risks of having the vaccination. Although the efficacy rate of the Sinovac is only 50% for all participants. But after second dose, with an interval of 1 month or 28 days, suppose the efficiency rate will increase to 62%. But still, it's only 62%. However, of course, because of many citizens in Hong Kong, they put confidence in the Chinese products, and then they had been worried about the side effects of BioNTech. They had more. They had more confidence in the Sinovac now in Hong Kong population. And also because the Chinese vaccine had arrived yesterday in Hong Kong already. And the officials, the government officials had all declared that they would get the vaccines. They would have vaccination of the Sinovac. So, and the BioNTech Pfizer one will only arrive next week at the end of February. And also because of the storage problem, the need for negative 70 degrees Celsius in storage and transportation of the vaccine. So I think with all these logistics, the rollout of the vaccination by BioNTech vaccines will probably begin in March, probably 10 days after the inauguration of the Sinovac vaccine campaign. So anyway, for the past month, because of so many rumors and also I would say fallacies about the safety of BioNTech vaccines, many Hong Kongers were quite suspicious, and I mean they were worried about the side effects and the deaths in Norway or Bell's palsy in Israel, although the authorities there had declared that those deaths and the the adverse outcomes were not proven to be due to BioNTech, but people were really suspicious, and so people would rather wait and see what other people had reported from vaccination of BioNTech. And now, of course, Israel had reported very favorably, but still people had been impressed by their perception last month. And so I think we still have to see how people would decide. But at least now people put weight on the Sinovac, although they didn't have their third phase trial reports in peer-reviewed journal, and also not enough data for the effect and safety in elderly people over 60 years of age.
Thank
So
you.
that's about the thinking in Hong Kong.
Japan, this is the picture in Japan, Mary.
Thank you very much. We've just begun to talk to the medical staff for the first time in Japan, and I assigned for the vaccination too. This third wave is now seems like getting controlled by now, but the government decided to continue the mild lockdown to control more during the vaccination. Thank you.
Then we have Nepal, Dr. Prakash. This is the picture in Nepal. Are you there?
Oh, that's very good.
Yeah, thank you. Thank you, Agrawal. In Nepal, now infection of the corona is decreasing, and but still we are in a risk of increasing because of a political gathering, political turbulence. The big gathering and processions are going on, but that's why we are expecting it might increase. But still, the vaccination has been started since 3 weeks before. First time we gave to the frontliner, then now we are vaccinating the government employee and the persons and office who are in front to the public. And from the after 2 weeks, we are going for the mass vaccination. That is the above the 16 years age. That's why now in Nepal, even though the infection is very less and the patients of seriousness is also less, but because of political gathering and procession, we are in risk to it might increase. Thank you.
Singapore. Dr. Chong. He was driving, he was there. Okay, so Dr. Chong, can you unmute?
Okay, can you hear me, President?
Yes.
Thank you, President. Anyway, in Singapore, we're in the middle of the Chinese New Year, which is the festive season, And with all their additional precautions, we are not allowed to visit each other except for 8 family members, 8 members a day. We're allowed to visit 2 households. So there's some sort of restriction. And we've vaccinated 250,000 people to date. I think most of the healthcare worker has received their second dose. All seems good. We had one patient 2 days ago who received his vaccination above 70. He's, I think, 73 years old and had an MI after that. So, of course, there was a big hoo-ha, but Minister of Health has come out to say that it is not caused by the vaccine. Otherwise, the Moderna vaccine has also arrived in Singapore 2 days ago. So we are doing quite a massive vaccination program. And we've started doing the 70 years old and above, all in the community, starting this week. So we hope to complete the whole population by August, which is our National Day. So that's the plan going ahead. Otherwise, the infection control in Singapore is the situation is very good. We have 0 to 1 case every day. So everything is good over here. Thank you.
And lastly, Bangladesh. This is the Pakistan and Bangladesh. You can see the number of cases going down. Yes, Bangladesh, Jamal. Jamal, can you speak about the picture is here of Bangladesh?
Yes. Can you hear me?
Yes.
Yeah. Thank you, Dr. K.K. Agarwal, and everybody here, Dr. Chong and others. So in Bangladesh situation, the vaccination is, I think, is much better. Initially, there was fear because of these rumors and others, and some sort of news from the from neighboring country like India. And so it actually happened. Initially, we are not having the so much response, but now the response is very good, and already in 2 weeks' time, more than 1% population has been vaccinated. We are giving the opportunity to up to the 40 years of age now. Previously, it was 60 years, then it has been extended. And now it's very good. And almost every day, we are about 300,000 is coming up for vaccination. And the infection rate also is decreasing, actually, which you have mentioned already. And it's near about 400 per day. Sometimes it is 250, 300 like that. And the detection rate is less than 3%. And so the thing is that the government is not ordering for lockdown, but the people are just gathering, and there are a lot of political gatherings also, which Dr. Prakash mentioned in our country also is going on. And we are surprised that why this sort of congregations are not increasing the infection rate. We don't know, but we are not sure. But the government has ordered no mask, no service in the offices. So that is executed here. So I think that has contributed to the less number of infections and detections here. Thank you so much.
Pakistan. This is the picture of Pakistan. Sajad.
Hello. Yes. Good morning, everybody. Hello. I've just, Mr. President, I've just joined the meeting. I couldn't get the what is going on. I don't know. Actually.
This is the picture of Pakistan on the screen. We are just enumerating what is happening in Pakistan. So every country is telling what is happening in their country.
Okay. In Pakistan nowadays, it's the number of cases is going down, as well as the death is also decreasing. So this is very fortunate. But same as Dr. Jamal said, the same scenario is we are observing here in Pakistan, that nobody is following the SOPs, nobody is wearing masks, nobody is keeping any distance, social distance. but still the number of cases is going down, and in hospitalization the cases is also not so much, so very little amount. The active cases are near about 2,000 to 25,000 only, and no serious cases. I have also receiving the COVID patient, but very little. I think couple of weeks before, I am receiving in my OPDs daily 4 to 5 cases of COVID, but I don't think that I have been examining any COVID patient last 4-5 days. So it's a good sign. And the vaccines is on in Pakistan. Sinopharm, as you know, the vaccine is being injected to the healthcare workers. But I don't know. This is very unfortunate. The doctors are not willing to have this vaccine. Very little percentage of healthcare workers are vaccinated in Pakistan. Because of that, as the government announced, the 60 age of healthcare workers who are above 60 are not supposed to have these vaccines. So they are waiting for the another vaccine, which is AstraZeneca. Maybe it may start from the first week of March. So we hope that with this uh, uh, as we all are not following the SOPs everywhere, in marriage ceremony, in gathering, in public gathering, in markets, even in the government offices. Even my observation, even the doctors are not following the SOPs. They are having shake hands, they are having hugging each other. So this is very unfortunate. Even then, the cases is decreasing down. We hope that if this thing is going in future, then definitely we will have no case in Pakistan in future. Thank you very much.
Thank you. So I'll give a small presentation before we go for final discussion. And but before that, Dr. Pillai, Dr. Martanda Pillai. Dr. Martanda Pillai.
Thank you, KK. The position in India definitely is very optimistic. As has already been mentioned, even in India, the SOPs are not followed. There are protests, strikes, mass gathering, everything is happening. But fortunately, we are plateauing and number is becoming less. But then 3 states are contributing to almost 60% of the cases. All other states, definitely there is a decline, as is obvious. And regarding the vaccine, the health workers generally has been accepting vaccine. The first round of vaccination is over, and a considerable number of people, doctors and health workers, have taken it. And the second round, at least in some states, it has started. And there are debates whether we have to give it within 8 to 12 weeks or maybe later on, because many of the studies show that if you give it still at a distant pacing, the immunity will be higher. So that again is debatable, and that is one thing which sort of puts off even health workers from taking the second dose. So that is the situation we have. The zero surveillance conducted shows that 21% of the population are immune, and this is the right time when the decline is there, and staged way health workers, then high-risk people and other categories definitely are opting for vaccination. And fortunately, the side effects have been very, very minor. Those who have died or whatever, and the studies show that it is not directly related to the vaccine. So the picture is optimistic. Only thing is we have to motivate, as doctors, medical men, we have to motivate the population to take the vaccine, and there is only solution. And definitely, Corona is not going to go, COVID is not going to go. It will still linger as a epidemic in certain pockets. And in those areas, vigil is required, and SOPs and isolation, testing, treatment, and those protocols locally has to be followed. And that strategy definitely is the need of the hour rather than being complacent that we have tided over the situation. Thank you.
Thank you, Dr. Pillai. So I'll come back to some small presentation of interest to everybody, and then we will open for discussion. First of all is every country is concerned about the research of cases. That means you have research in cases. Every country is concerned about that there will we get another wave or not. So it depends upon three things. It depends upon three things. There has to be a mutation for it to rise again. That mutation can be a deletion or a substitution mutation, which we will talk in the coming slides. Or it has to be in RBM part of the virus. Spike protein S1 in RBD in the RBM segment. We require that mutation. But mutations are occurring, 2 mutations per month. Most of the mutation fizzle out unless they get 2 things. So the COVID appropriate behavior is absent. That means you become careless about your lifestyle. Even that will not cause a surge in cases unless there is a super spreading event. So 3 things are required for increase in cases in the city when number of cases are going down. So Bangladesh, Pakistan, wherever, whichever country we find, say in India, in Maharashtra, we are seeing a surge, and there are all 3 of them are involved. There has to be a mutation. So in India, we have 2 mutations going on. Both the mutations are in RBM independently. So there has to be a mutation. There has to be a COVID appropriate, inappropriate behavior. So there has to be a COVID inappropriate behavior that people have to stop wearing masks. And there has to be a person who is spreading the infection as a super spreader. There has to be a super spreading event. Unless 3 things happen, the disease will be under control. Now, when we talk about deletion and substitution, the virus is likely to mutate. The job of the virus is to mutate. Mutation can be deletion of an amino acid or substitution of an amino acid. When there is a substitution of an amino acid, that means Pakistan was supposed to give the lecture first, but by mistake, Bangladesh came forward and they gave the lecture first, and Pakistan objected. Then in the next session, you can recorrect it. So any substitution mistakes can be corrected by the proofreading mechanism. So therefore, all mutations which are substitution based may get auto recorrected unless they are associated with deletion. Suppose we delete a particular country from the CMAAO membership, they cannot come back unless they reapply. So therefore, a deletion type of a mutation will be permanent and not a substitution type of a mutation which may get recorrected over itself. So at this moment in India, in Maharashtra and in Kerala, we are having substitution type of mutations. And because they are substitution type of mutations, outside India, nobody is talking about them. Bangladesh is not concerned, Pakistan is not concerned, rest of the India is not concerned. They say this is a local problem of Mumbai. And the spurt of cases will come and go back because they are substitution type of mutations. But the mutation in UK is 69, 70 and 144 deletion. So everybody is concerned about this mutation cannot go back and recorrect itself because this is a, so therefore the concern is will always be of a deletion, which we will come back. Now, when there is a deletion, what can it do? When there is a deletion, what can it do? Let's say the UK strain. Let's see the UK strain and why that strain becomes important. The mean in the UK strain, the viral load is lower, but the mean clearance time is higher and the mean infection duration is also higher. That means normally when we say the virus is dead on 8th day, may not be applicable to UK strain. So what does a virus want? A virus wants not to die in 8 days. It will like to persist. So any mutation, next mutation will be that virus would like to stay on in the body for a longer period of time. So in UK, the strain in the UK, we have seen that happening. That the immune infection duration has shifted from 12 days to 20 days. And the mean clearance stage has shifted from 8 days to 12 days. That means if you have an infection with the virus present in the UK, which is B117, the formula of 10 days isolation will not apply. Therefore, if you have a, so therefore these cases will go on infecting even after 10 days. That's what the study which has come published in Harvard. So therefore, a newer mutation would mean a longer period of isolation. Is that the case in Mumbai? And this also will hamper the virus characteristic about a new spurt with that. And this is the same thing which is clearly showing that the new virus is less virogenic, less viral overload, less viral load, but persistence is more than the initial virus. And that's what it says. So this can be, so the good news is viral load is low, so therefore less seriousness. But bad news is that isolation period may be 14 days now instead of 10 days. Now, the second news which has come in the literature is that even it is not important which mask you use, any mask if you use, because of humidity, the mask becomes better. The third thing which I wanted to come back to the mutation again is, how do we suspect a mutation? It is important for us to suspect a mutation. Suddenly, if you find that the doubling time, 10 days doubling time has started reducing. 10 days doubling time is 10 days, you mean mutation has occurred. If there is a gene target failure, normally a S gene target failure, suddenly you start finding that S gene test is negative, others are positive. Or you start seeing a mutation in RBM on RBD in the society. Or if you start seeing a deletion mutation in the society, or if you see a spurt of cases or mutation with super spreading event. So therefore, the mutations can be a deletion or a substitution. Now, if you see this virus in the bottom, these are called, the deletion is only seen in UK variant. The deletion is only seen 69, 70 and 144 deletion in UK variant. The South African, the virus in the South Africa And the virus in the Brazil does not show a deletion. Therefore, if you have seen the picture in South Africa, the cases are rapidly going down. And the virus in the South Africa is not spreading throughout the world as much as it should have been. In spite of all the three mutations, substitution mutations in the spike protein, in the RBD and RBM, the whole world is talking about the strain in the UK and not in the South Africa. The reason being there are three deletions in UK virus. Deletion means autocorrection cannot be possible. So therefore, in this UK edition, one of the person had acquired E484K from the South African virus in South Africa. And therefore, if any of these three mutations, that means 417 or 484, from the virus in South Africa or the virus in Brazil, like it happened in Japan, if it is acquired by the UK, then only it will become a variant of most concern. So in India, you have mutations coming of 484, and we have a 440 mutation coming in India, but they are localized. So a substitution mutation will always remain localized unless it acquires a deletion. So I give more importance to a deletion mutation than to a substitution mutation. Now, these are the cases we have already talked. Then I just want to come back to two more things. Could mutations of SARS-CoV-2 suppress diagnostic detection? So when we do a diagnostic detection, we do RDRP, S gene, ORF1AB gene, N gene, and E gene. Now more and more countries are shifting from single gene testing from triple gene testing. So I feel that countries should do a triple gene testing. Single gene means people are not doing only E. If E is negative, they are not doing tests further. And if E is positive, then they are doing a N protein and they say positive or negative, or they are doing RDRP. E and RDRP they are doing, which are not detecting the early mutations in the country. So I feel that triple gene testing should be done. So, now this study shows that whatever may happen, the N gene will never get suppressed by any mutation. So therefore saying N gene target failure will never come. And another thing which I am showing here, and there was one more, which was, yes, I'm coming to that. This is what they talk about is delayed onset myocarditis following COVID-19. So they are saying in delayed cases, you are getting multi-system inflammatory disease in adults also. Now this is important that France says for those people who have already had a virus, they need not take the second dose of the virus vaccine. Only one vaccine will be sufficient. And this one is the most important, that up till now, the virus wants to stay longer. So we showed it to the 14 days, but this paper has shown that in a 56-year-old patient, the 4 months after initial infection, the virus was lying in the body and it reactivated. So first evidence has come that in immunocompromised patients, the virus can get reactivated, something like it is going towards a hepatitis C. So if these types of things are allowed, this virus may become a chronic virus. So I wanted to share these updates, which I thought are worth discussing with all of you. And the only thing I want to say is that if a country, everybody says the second wave will come. If the second wave comes, it will be a mutation. If the mutation is a substitution mutation, it will be temporary. If it is a deletion mutation, it will be permanent. There has to be inappropriate behavior of the people. There has to be a super spreading event like a immunocompromised person, and there can be a different virus behavior. In the mutation, the virus has to behave differently. The mutation has to be of such a type that because of the mutation, now the person is spreading for a longer period of time, then only cases will increase. Over to the chair.
Thank you, President, for that illuminating talk that you've prepared for us. It's quite challenging to see all these variants emerging and the threat that they pose to all the countries in the world. I think, as we rightly said earlier, that vaccination is the way to go, because if the virus can't replicate, then it can't delete and mutate. So I think it's good to hear from everyone that all the various countries are stepping up their vaccine efforts, and we hope to cover as many people as we can in this year. And I think that's the way to go. Thank you, President.
So I got my dose of second vaccine is due on Monday, and I checked my antibodies from 2 different labs. Till now, I haven't developed antibodies. So no, these are the types of reactions which will come. So those people, if you don't develop an antibody, that's a new recommendation now. They should go for earlier second dose, as I am going on 30th day, I'm going for a vaccination. But they are also saying all those cases who don't develop antibodies at all, okay, if they develop a corona, that will be a marker of a mutated virus. So only a mutated virus will cause infection in them and not a normal virus. So the virus strain which has been given to you as a vaccination may protect you from that vaccination, but it may not protect you from the mutations. So that's another recommendation which has come yesterday, is that 5% of Moderna Pfizer failures, if they develop a virus, take it for granted that's a mutated virus.
Mr. President, can I? Hello. Dr. Kaisar here, Sajjad.
Yes.
Okay. I have 2 questions. One is that I can't get you that
Your voice is not coming.
That the Pakistan was not Bangladesh. I can't get your reference you are talking about.
What was that?
You said in your presentation a couple of minutes before that Pakistan was not representing something. What you said,
No,
I
no,
don't
no.
I don't get
I
that.
was creating a joke. I was creating a joke that in case, suppose there is a conference going on.
Okay,
In that conference, if in the conference by mistake, if the turn is of Pakistan, and if Bangladesh gives the lecture and Pakistan objects that why did you allowed him to speak before me, if that situation can be corrected by the chairperson, that is called substitution mutation. But if Pakistan turn is deleted, then he's going to become angry that why did you delete my talk? So I was creating an example of a substitution versus a deletion.
Very good example. Good. Thank you.
Mr. President, can I just raise a question? Actually, for you, this India is just vaccinating after 1 month. This is Covishield, and Bangladesh also is having this Covishield. So initially, Bangladesh are also planning for 1 month, the gap. But now, as the WHO recommends that Covishield should be given after 2 months, 8 to 12 weeks apart. So Bangladesh also is following the same thing now. So this controversy arises, and how India is going with 4 weeks apart here. This vaccination.
I am telling my patients is that if specifically to the doctors to get the, say for example, I would have waited, but I am going because I did not have the antibodies at all. Therefore, I'm going. But in a country like India, I don't know. It is scientists will have to decide. If the WHO is saying that you can wait for 3 months, India should have waited for 3 months, because it's easier to give first dose vaccination to more number of people, because that will help like Israel to reduce your transmission rate. I have no idea why government is planning and not changing their policy. Dr. Pillai can answer if he has some answer.
Okay, Mr. President, can I complete my questions, Mr. President? Okay. The other questions I'd like to ask: which vaccine is very effective? I mean, as compared to the younger one above the age of 60. Which vaccine is more effective?
Let me talk about, when we talk about vaccine, so one is called allergic manifestation of an allergy. So allergic manifestation of allergy will be the same in all types of vaccines. The second is called reactogenicity. Reactogenicity will be least in the killed variant, which is Sinovac or Covaxin. It will be maximum in RNA virus. Second highest will be in a DNA virus. These are called reactogenicity. Third will be immunogenicity, the number of antibodies produced after 2 weeks. That again will be lowest in a killed virus, but they will be same in other viruses because they are producing the live virus, live spike protein. So when we talk about a killed virus, they are safer, but they are also less immunogenic. Therefore, they may require multiple doses. But reactogenicity is nothing to do with immunogenicity. Reactogenicity is the response of the body. This is the gamma interferon response of the body in reaction to a foreign protein.
Okay, the last one is I would like to ask everybody from every country representing here, how many doctors in your country is expire during, I mean, suffering from COVID-19?
India more than 700, between 770 approximately.
In Bangladesh,
doctors only. Doctors only.
Yes, doctors.
Yeah, in Bangladesh it is 130.
130. Okay. We have 191 till today. 191. 191.
Nepal.
Thank you, Mr. President. Thank you.
In Hong Kong, there's
anybody
no.
Else? Yes.
In Hong Kong, yeah, thank you. In Hong Kong, no doctor had been, suffering from the COVID-19 after the only doctor had been treated in the ICU, and that doctor had also recovered. And so no doctor died from COVID-19 in Hong Kong, but of course, Hong Kong only has a 7.5 million population. So I also like to ask the president. So in fact, for the mutation, some countries have already suggested to perhaps consider to give the third dose. Do you think that is a rational decision? Any scientific evidence to support that, to give a third?
My concern with the third dose is, in a naive patient and the second dose in an already affected patient is that we should not precipitate multi-system inflammatory disease. So unless I get an evidence that the vaccine is safe, multiple doses of vaccine may precipitate inappropriate adaptive immunity leading to multi-system inflammatory disease. So as on today, some people are talking about it, but me, as far as I am concerned, I will be against third dose. And I will also be against the second dose of a vaccine who have already suffered from the COVID and they have antibodies. Because if you are giving repeated antibodies, you are increasing the chances of corrupt antibodies being forming and multi-system inflammatory disease. So
Thank you.
I call three types of antibodies in a person: corrupt antibodies, and then useless antibodies and useful antibodies. Corrupt antibodies will
Right.
precipitate, facilitate another virus to enter in, leading to multi-system inflammatory disease. Inadequate and ineffective antibodies will not do anything. And then effective antibodies will prevent. And that effective antibodies are neutralizing antibodies. So you are neutralizing, non-neutralizing, and facilitating antibodies. So the more the antibodies are formed, more repeatedly the infections are. If you end up in developing a corrupt antibodies, which facilitate an infection, you may have a trouble. So I am not inconsistent with the third dose as of today. South Africa has just informed 300 people have died, doctors have died in South Africa.
So, Mr. President, so in fact, the same reasoning should apply to the risk of vaccination to those people who had already got the COVID-19 infection before. That could also precipitate a cytokine storm or, unnecessary corrupt antibody.
That's what it is happening. That's what it is happening. That's what it is happening. Only the MIS is only happening in people who have earlier developed the infection. How they are working, we don't know. Brazil has just informed 440 deaths. Sanchita, you can note down all the deaths in various countries.
Yes, sir.
Mr. President, is there any relation with you not having the antibody, taking some pre-medications which you have taken? And I have also taken these precautions as you advised.
I have checked with many immunologists. There is the pre-medication will not reduce your immunogenicity. It will help in reducing your immediate reactogenicity. So if you feel that that reactogenicity can be harmful to you, so pre-medication needs to be taken in high-risk individuals.
Thank you.
Yeah, in fact, Mr. President, I think your advice today is very important. I think the governments of different nations should have swift and prompt policy to determine the timing of the second dose now. So in fact, because if the interval between the two doses is really important, say 8 to 12 weeks interval, is giving a much better response developing antibodies in the vaccinees, then it should be made a policy as soon as possible. Otherwise, those people could not develop enough antibody after 2 doses 4 weeks apart.
Agreed.
They should not have the third dose, right?
Agreed.
Yeah.
So if there are no more questions, I'll ask the chair to sum up.
Thank you very much, President. As always, a very illuminating talk by the President, who's always done his homework for all of us. Armchair immunologists we all have become. And it's good to see that from the feedback around the region that vaccine programs are underway. And most of us hopefully be able to see some light at the end of this tunnel. It's been a tough year for the whole world, and in particular for many, many countries and their populations and their healthcare workers. So I think going forward, we can be guardedly optimistic that the vaccine programs will continue to roll out across the world. And we would also like to see less of these vaccine wars and more of the population accepting the various vaccines that they have access to, and reducing vaccine hesitancy. So I think without much ado, let's be guardedly optimistic. Let's be guardedly hopeful that we finally see some light at the end of this tunnel. Thank you all as usual for a lovely session, and I look forward to all of you next Saturday again for another illuminating experience. Thank you all.
Thank you.
Thank you.
Thank you, Chairman.
Thank you, guys.
Thank you,
Bye.